because this procedure, it's a very big day for them and emotions are running really, really high.
True, yeah.
Some patients cope really, really well and some don't. I would say embryo transfers are a lot more relaxed
Mhm.
and a little bit nicer as well because I feel like I'm able to support the patient a little bit more because they're awake. You wouldn't be aware of as a patient that when you come for your egg collection, you take a certain medication called a trigger, and that means that your egg collection should be at a fixed time. And there is a period, a couple of minutes before, a couple of minutes after that, it can still be safe. So sometimes, yeah, you just need that extra bit of support. As I said, it may be hand holding. I may tell a little joke to lighten the mood. Whatever makes the patient feel comfortable and feel well, I will try my best to do that.
Welcome everyone to the new episode of Let's Talk Embryology. In this episode, we have Lauren, who is a HCA or healthcare assistant, and she'll talk to us about what actually happens in a theater during egg collection or embryo transfer and how she plays a vital role during this procedure. She also talks to us about what happens after the procedures during the pregnancy scans and also how she supports patients going through their fertility journey. This is going to be part one of the episode, so stay around for part two, which will be released in a couple of weeks. I'm your host Devesh. Let's begin. Welcome, Lauren, to the new episode of Let's Talk Embryology. How are you feeling being here?
Good, thanks, Devesh. How are you, love?
I'm good as well. Thank you so much. It's going to be exciting part because we had a nurse before and also a lab admin, but now we have another nurse who will talk to us about the ins and outs of the theater and also facing with the patient. So I'm sure it's going to be an interesting episode.
Yeah, I'm excited to get
Yeah,
chatting.
perfect. So can you just tell us what you do at the clinic?
So I'm actually a healthcare assistant at the clinic, and a healthcare assistant is someone who assists the doctors and the nurses with procedures, scans, and things like that, just helping in the day-to-day running of the clinic.
Mhm. And what are your roles as such when you say you help the patients or when you say you help the doctors? What do you exactly do at the clinic?
So in terms of helping the doctors and the nurses, I'll assist them during procedures. So
Hmm.
that could be an egg collection, a high cozy, it could be an embryo transfer, microTC, things like that. And then also chaperoning, and chaperone is just assisting the doctor in it, transvaginal scans, abdominal scans, testicular scans, things like that.
Oh, interesting. That sounds a lot
Yeah,
to
it's a
do
very
on a
broad
day-to-day
spectrum, so
basis.
I'm never
Yeah.
bored.
That's nice. And did you always wanted to get into this career, or did you come across something and then you thought, oh, this is interesting, I should try this?
To be honest, in terms of healthcare, I've known from a very young age that
Mm-hmm.
I've just always wanted to work in healthcare. It's
Mm-hmm.
something that I've wanted to do since I'm very, very young. But in terms of fertility, I actually accidentally fell into fertility,
Yeah.
and loved it and never left.
Nice, nice. And was that the reason that you got into fertility and not the regular nurse that we see in hospitals? Or is
Yeah,
there a
so
reason behind it?
throughout my career, I've done a little bit of everything. I've done emergency department, I've done psychiatric, I've done geriatric care. And when I moved to the UK, when I moved to London from Dublin, there's not really much fertility in Dublin as that I knew of. And when I came here, I seen that it was a really big market and it was really well advertised here.
Mm-hmm.
I had heard about it, but had no experience, so I didn't think to even bother trying to apply for a job.
Mm-hmm.
And then when I was looking to move jobs, when I had just first moved here, um, a recruitment agency actually contacted me and said they had a position available in a fertility clinic and would it be something that I was interested in. So I had a little look up and I thought, absolutely. I was like, this is definitely something that I would be interested in. But I was nervous because I didn't have any experience. And they said that they were happy to train me up. And like that, as I said, I never left and I love it. And as much as I've done little aspects in everything throughout my career, fertility is definitely where I will stay. And fertility has my heart, let's say that.
Interesting. Yeah, that's a good way of saying it. Just to your entire work and your entire interest lie in fertility. Yeah, that's a good thing. And when you say you worked previously in Dublin, what sort of work did you used to do there?
So in Dublin, healthcare assistant jobs wouldn't be as advanced as what they are here.
Okay.
So I wouldn't do things like taking bloods or assisting with procedures in that sense. It would be more assisting the doctors, like handing them things during dressing changes, maybe assisting patients with feeding, changing, washing, things like that. So I would say since moving to the UK, the list of duties and list of experience that I have has grown quite
Hmm.
significantly in the last 5 years that I've been here. I just feel like everywhere is different and rules and regulations are just a little bit different, where I feel like the UK is probably slightly more lenient as to what they would allow healthcare assistants to do without actually having a degree.
Mm, right, makes sense. Yeah, yeah. And are you from Dublin originally?
Yes, born and
All
bred.
right, perfect. And what education did you do? What universities or degrees?
So I finished secondary school, did my leaving cert.
Hmm.
It's kind of same as like A levels in the UK, I think. And then I did a 1 year course after that. It was called pre-nursing studies,
Hmm.
and with that course, I was then able to get a job in a nursing home, and that's where I worked for 4 years before I then moved on to working in hospitals
Right. And after that, you moved to UK and
to
started
the
working in
UK.
fertility.
And said I worked in a GP when I first came here for six
Okay.
months
Uh-huh.
and then moved into fertility. So I've been in fertility ever since then.
Nice, interesting. How is it going so far for you?
I really love it. I love that I learn something new about my own body every single day. I feel like as a woman in schools, we're not really taught much about our bodies and how they function. And I was actually a little bit embarrassed and ashamed to think that I actually knew nothing about my body until I started working in fertility. Just as something as simple as being able to explain to someone now how your menstrual cycle works, where I would have only known what we were taught in schools beforehand, do you know?
Yeah, yeah,
Um, so yeah, I'm learning a lot. I get to teach my friends a lot, which is great. Teaching my friends how to advocate for themselves in healthcare as well, which I learned from the doctors and the nurses that I work with to date. So yeah, it's I really like that I can share this information. I think that's also another perk of the job and reason why I love the job, being able
right,
to educate my peers and my family about their bodies or if they are struggling to conceive what they may or may not be doing.
right. So in short, you love your job totally. Looks like
Yes.
it. Interesting. Okay, so coming back to the clinic, can you just explain to us what happens during an egg collection and also embryo transfer or any other procedures? So what do
Yeah.
you do exactly?
Of course, so we'll start with egg collection. So during an egg collection, I will go to the patient's bay and collect them from there, walk them to the theatre. When we bring them into the theatre, I'll sit them onto the bed, put them in the correct position. We'll then do an ID check with the doctor, the embryologist, and everyone present in the room so that we can then confirm that the patient is who they say they are. And we have multiple people to check that. Then the doctor will go into the lab to do some other checks, and while they are doing that, then I further help the patient into the bed and make sure that they're safe. Sometimes during this time they're being put to sleep, so they're being cannulated into their hand or into their arm. This can be very stressful, can be quite painful sometimes. So if needed, I offer a supportive hand. I could hold the patient's hand and maybe comfort them using my words or however I see fit and depending on the patient, what they may feel comfortable with.
Mhm.
Once the patient is completely asleep, then the doctor will come back and I will open up the tray and all of the equipment, the sterile equipment I had set up previously will be there. The doctor will start the egg collection. As the egg collection starts, then the tubes that are in a warmer, so the fluid that's being collected from the follicles in the woman's ovaries, is then brought through tubing, through a suction method, into a test tube. And the test tube then goes onto a warmer that's on my table. I then have to keep an eye on that, let the doctor know how it's flowing. So maybe sometimes it could be the color of the liquid that's coming out, it could be the rate that it's flowing, whether it's fast, whether it's slow, whether it's stopped. It's really important to keep communicating with the doctor during the procedure, especially during that time when they're draining the follicles. Then once the tube is finished, I'll let the doctor know that I'm changing the tube. I will then safely close the tube and safely walk it to the lab where an embryologist will collect it from another warmer, and then they will analyze it then to see if they find an egg in that fluid then. So that is repeated until we are finished with the egg collection, until the doctor has drained all of the follicles and there's nothing left to drain. The patient will then start to wake up. So we start again positioning them in the bed to make them feel more comfortable, to get them ready to be recovered back in their bay. And with a very busy list, you just clean and go again.
Interesting. It sounds a bit busy procedure because you have so many steps at the same
You
time.
know what? It is. And I will admit, the first time that I watched one, I was like, I'm never going to be able to
Yeah.
do this. I'm never going to be able to do this. Because not only that, as well as changing the tubes, sometimes the doctors may need flush. And flush is essentially a liquid that's injected into the follicle. And it's almost like mouthwash, as we say. And it clears out and hopefully then will retrieve an egg if it's stuck there. So if you're flushing and the doctor has also asked you to change the tube at the same time, sometimes it can get a bit panicky. But as I said, as you do more of them, and I'm so well supported at the clinic that I'm at now, and I'm doing it so long now that it's just second nature to me now.
Interesting. I was going to come at that part where you change the tubes, but you already answered because when you say you're the only one doing all of these things in the theater, changing the tubes, which has already collected follicular fluid, and also providing flush, changing the needles at the same time. Is it tricky to do all of these things because you don't want to miss tubes which are
Yeah,
collecting the
it
follicular fluid,
is.
and
And at
also
the
you
end of
don't
the
want
day,
them to overflow. So that's such a tricky part to manage everything in that short amount of time.
100%. And I think my main concentration is on those tubes. They are my main focus. So
Mm,
before the doctor gets a flush from me, I have to secure that tube. So
mm,
it's just me knowing what is appropriate in that procedure then.
mm. Yeah. So when you moved on into fertility, being a fertility HCA, um, when you started doing these kind of procedures, was it tricky to learn these things? Because I imagine these must have been completely new for you, coming from a
Yeah.
different kind of HCA.
They're completely new and definitely more responsibility, I would say, on my role. It was a little bit tricky in the beginning, but
Mm,
like that, just lots and lots of practice. And I'm a person who's not afraid to ask for help. So there's often been times where I say, actually, I don't know what I'm doing, or I
right,
don't feel safe, and I need someone to assist me. And I think there's no harm in doing
right,
that. At the end of the day, the whole team, what we want is what's best for the patient. So I think sometimes you have to put your ego aside and think, what's best for my patient? I need help and I just have to ask for it.
right. Yeah, that's true. Yeah, you just want best for your patients and then make sure that you get through it one way or
Exactly.
the other. Yeah. And how long did this training take place for? How many
So
months or
I
weeks?
trained to do egg collections, I would say, with someone supervising me for about 8 weeks.
Right.
Yeah, I would say about 8 weeks. I wasn't doing egg collections every single day, but I was probably doing maybe 3 or 4 days a week. So quite a lot of time.
Hmm.
Um, and the good thing is that egg collections are typically in the mornings. So I was being trained on that in the morning and then something else in the afternoon. So it didn't take up my whole day. So I didn't feel like I was just doing the same thing over and over again. It was
Right.
actually a nice mix then.
Right. Right. Makes sense. Yeah. And after the procedure, do you do anything for the patient? Do you have to do anything to make them help recover?
I think it depends on the needs of the clinic. Sometimes the nurses outside in the recovery bays could be very busy, and I know that I have 10 to 15 minutes free before my next egg collection. I may stay in the bay with the patient and take their first round of observations. So we wake them up inside the theatre, and then once they're awake, we then bring them to their bay. They're still a little bit groggy, so that's why we do another couple of sets of observations. That could be their blood pressure, their temperature, checking their oxygen saturation levels, things like that. So if, as I said, again, this just depends on the needs of the clinic. If I'm needed outside for a couple of minutes, then I can also do that as well. Once someone comes to take over from me, I can then go back in and start cleaning and setting up for the next patient then.
Right. Yeah. You just have to run along through the list, doing one
Yeah.
job after the another. Yeah.
Exactly. And I think
Imagine it
that's
would be
the
busy.
stressful part as well that I think that some people aren't aware of, like you wouldn't be aware of as a patient, that when you come for your egg collection, you take a certain medication called a trigger, and that means that your egg collection should be at a fixed time. And there is a period, a couple of minutes before, a couple of minutes after that, it can still be safe. And we do allow ourselves that time so that if things run over, but sometimes patients, we can't find any eggs, or there's more eggs than expected. So you're thinking, oh God, we need to make sure that we finish soon so that we can take the next patient in. So sometimes that running theatre on time can be a little bit stressful. But as I said, we just communicate as a team, make sure that we're doing things safely and by protocol. And if we continue to do that, then we should finish
Right.
at some
Right.
stage.
Right. Stay on track and finish
Yeah.
the list. Yeah. Is egg collection any different in terms of all the steps that you do than an embryo transfer?
Yeah, so I would say embryo transfers are a lot more relaxed
Mhm.
and a little bit nicer as well, because I feel like I'm able to support the patient a little bit more because they're awake. Obviously you can have a sedated transfer, but they're not really that common. A lot of patients will have them while they're awake. And same again for an embryo transfer. I'll go and collect the patient from their bay. We'll bring them in. We'll do some ID checks, make sure they are who they say they are. If their partner is present, they will also have to do the same. Then the lab will discuss the quality of the embryo that they have thawed that day, and they will let them know if they have any left in storage. The doctor then will go into the lab, do some checks. While the doctor does their checks, I again position the patient onto the bed and I will abdominally scan them, so just their lower tummy. I need to scan them because I need to make sure that their bladder is full, comfortably full. The reason why we need their bladder to be comfortably full, because we're abdominally scanning them and we need a full bladder for good view and also for positioning of the uterus. And the bowel and stuff like that can sometimes get in the way. And so if your bladder is full, it then pushes the uterus down to form a straight road, may I say, for
Right.
the doctor in order for them to place a catheter in place to do the embryo transfer. So while the doctor is next door, I will scan a patient's tummy and make sure that their bladder is adequate enough, make sure that I can see adequately enough. There is times that patients' bladders are not full. In that case, it's not the end of the world. I tell them just sit back out in your bay and drink some more water. And then we can just go ahead with the next patient if their bladder is ready, and then we can just come back to them whenever. When they are scanned, I'll get them to put their legs into their final position. I'll then raise the bed. The doctor will come in. I'll have already set up the table. Um, all of the equipment is there, like speculum, a catheter, cleaning equipment. The and while the doctor is doing all of their bits like cleaning and stuff like that, I'm just chatting to the patient, trying to make sure that they stay calm,
Yeah.
because this procedure, it's a very big day for them and emotions are running really, really high.
True. Yeah.
Some patients cope really, really well and some don't. And especially with having a speculum inserted, I'm sure any women listening to this will know that having a speculum inserted is not the best thing in the world. It's not your favorite task to do as a woman. So sometimes, yeah, you just need that extra bit of support. As I said, it may be hand holding. I may tell a little joke to lighten the mood. Whatever makes the patient feel comfortable and feel well, I will try my best to do that. Um, the doctor will then say that they are ready for me to start scanning again. I will start to scan again, and I will scan so that the doctor can see where the catheter is going, essentially. Once the catheter is in the correct place, the doctor will let the embryologist know that it's time for the embryo. They will bring the embryo in. Meanwhile, I'm still scanning. Sometimes I will have to relieve the pressure from the stomach because patients' bladders are quite full and they're quite uncomfortable. So I will remove the scan and just let the patient know that I'm removing this now. So you have a little bit of more comfort. However, when the embryo enters the room, I will have to press down again. So it's all just about keeping the patient in link with what's happening. Sometimes it can be quite a couple of minutes before the embryo is actually brought through, and that's because the lab have their own checks to do again and make sure that they're doing everything safely, so it cannot be rushed. Precious cargo to be brought through, so things can't be rushed. So yeah, it's just trying to make sure that everything is calm. Sometimes we'll have a nice playlist playing with nice relaxing music. Sometimes I really find that helps. Once we get the all clear that the embryo has then been placed, which we can see on ultrasound, the patient will go up. Sometimes I'm able to get them a nice little picture of their fluid that contains their embryo because it's actually too small to see the embryo on the scan. So I always tell them that that's their little star and to make their wish. And yeah, wish them well, tell them that they can go to the toilet straight away because that's usually the first question they ask, when can I go to the bathroom?
Yeah.
And we just tell them that they can sit out in their bay then and wait for the nurses outside to give them instructions on the
Yeah.
do's and the don'ts over the next couple of
Yeah.
weeks then.
Can you
So
see
I
an
would
actual
say,
embryo on the scan? Like you said, you take a picture.
so we take a picture, we actually can't see the embryo. So the embryo is actually inside a small bit of media, a small bit of fluid. So
Right.
that's actually what we see. The bright white light is the fluid containing the embryo. We know it's containing the embryo when the catheter is taken out, given back to the lab, and they will check under the microscope to make sure that the embryo, sorry, has in fact left the catheter. Sometimes they get a bit sticky and they like to stay there. So it's always just about making sure that the embryo actually is inside the patient.
Right. Yeah, that by the sounds of it, it looks like it's quite time-consuming procedure, what you were described right now. So does it take similar time as to egg collection, or is it much quicker than egg collection?
Again, it's all patient dependent. It really, really is because everybody's body is different. Everybody's anatomy is different. Sometimes we'll have to switch up what we actually do on a normal egg collection. So on a normal egg collection, a normal embryo transfer, typically we'll go in with a soft catheter to try not and disturb the lining or the cervix in any way. We try and go in and out unnoticed, as we say.
Right.
Sometimes this doesn't work. Patients, their cervix or the way their lining is, it may not work, that we might not be able to use the soft catheter. We may have to use a different catheter. So things like that, switching things up can actually delay the process a little bit. So it's very hard to say if one procedure is longer than the other because it really, really is just patient dependent.
Right. Right. And I imagine since this is not under sedation, this procedure, embryo transfer, recovery time might be less as well as compared to
Yes,
egg
so
collection.
recovery time is almost instant. The patients are typically not in pain. It's more so discomfort than pain.
Mm.
So as soon as they stand up and as soon as they go to the toilet and are given the list of instructions of when to test, what to do with their bodies, what to do exercise wise over the next couple of weeks until they do that pregnancy test, then they're free to go. Usually after an egg collection, they will recover outside for typically, I would say, around an hour and a half max. Where embryo transfers, they can just nip off straight away then.
Right.
A lot of patients will say, do I need to stay here with my legs up in the air? And we just tell them, oh, that's an old wives' tale. You don't need to do that.
Yeah. There must be a lot of questions that you must be getting from patients. These kind of questions, which will help
Yeah,
probably in increasing their success rate of embryo transfer. Yeah. Are there any other questions that
exactly.
you
And I just
that you
tell,
get?
so yeah, that is one of the main ones as well. They're like, what can I do? Can I do anything to increase my chances? Well, what can I do? What can I get? What can I take? And I just tell patients that actually they have done everything that they can up until this point to help themselves get pregnant, and they should be very proud of themselves because it's a very long journey to get to an embryo transfer, because you could have an egg collection, collect eggs, try to make embryos, and you actually don't, and then you have to start the process again. So a lot of these patients that are having embryo transfers, they could actually be patients of ours for probably about 6 or 7 months before they actually go ahead and have their embryo transfer. So yeah, it's just trying to make those times special for them if we can.
Yeah. I think patients are much worried about the outcome of embryo transfer or any other procedure. So they must be thinking the best for their body and also for the pregnancy. So they must be coming with a lot of questions, which will maximize the success rate, which is quite understandable, I think. Yeah.
Yeah, you can completely understand. A lot of patients are there quite a long time, and they really wanted to work, and we
Yeah.
really wanted to work for them as well. So we just give them the information that we have and tell them that, as I said, there's nothing else that they can do. They have already done everything. That unfortunately we just have to wait
Yeah, that's true.
and see.
Well, thank you so much, Lauren, for doing this episode. It was a really good insight into what you do at the theater. So we got to know about the ins and outs of your daily job and what actually happens in the theater. So thank you so much for sharing that.
Thank you so much for having me on. It was really a pleasure, and you've been such a pleasure to talk to and chat to. Really appreciate it, Devesh.
Perfect. And to our listeners, this was just the part one of the episode. So there will be a part two. So just look out for that. In this part, we talked about what actually happens in the theater during the procedure. But now in the next part, we'll talk about what happens after the procedure until the childbirth. So keep an eye out for the next episode. Thank you so much, Lauren. See you next time.
Thanks, love. Take care.
Thank you. Bye.